Okay, we might get started. Thanks very much, everyone, for joining us this morning or this evening, wherever you are. So my name's Dave Copland. I'm the lead for the CATS working group on cognition and aphasia. And this is the first in a series of seminars to celebrate the fact that CATS is turning 10. So quite an old cat. I looked up what the material for the 10th anniversary is, and it's apparently tin or aluminium. So I don't know what we do with that information. But this is, so the idea of this seminar series is to highlight some of the great work that CATS working groups and officers have been doing over the last 10 years. Just in terms of housekeeping, if people can keep themselves on mute, except the speakers. The idea of these seminars is that it's a fairly snappy half hour, and so we won't have time for questions during the seminar. But if you do have any, both our speakers are very happy to follow them up via email. So if you just note any questions you have, and yeah, happy to let you do that. I think that's all in terms of housekeeping. So today, the first cab off the rank is Dr. Sarah Wallace and Associate Professor Erin Godecke. So Sarah's a National Health and Medical Research Council Emerging Future Leader Fellow at the Queensland Aphasia Research Centre at the University of Queensland. Sarah is also a research officer for CATS. Erin is an associate professor at Edith Cowan University and a member of the Trials for Aphasia Panel and deputy lead for the CATS Aphasia Datasets Working Group. And today they will be talking about 10 years of methodological advances in aphasia research, which I think is fantastic. To get through that in 30 minutes is a brilliant thing. So I'd like to welcome Sarah now to start off.
Thanks, Dave, for that welcome. Yes, so 10 years is a lot to get through in 30 minutes. And so really, we are only highlighting a few of the projects and initiatives that have happened across the last 10 years in CATS. And I'm going to be talking about two of the pieces of work that I have led as the research officer for CATS, which is the reporting standards for participant characteristics in post-stroke aphasia research, which we call DESCRIBE, and the ROMA, so the research outcome measurement in aphasia core outcome set. And then I'm going to hand over to Erin, who's going to talk about some of the great work that the Trials for Aphasia Panel TAP have done. So first up, I'm just going to talk a little bit about the DESCRIBE study. And really, this came about from the idea that researchers really collect and report different information about participants in research, and that this helps us interpret and apply this information. But over the past 40 years, we can see from the graphic on the screen that there have been a number of audits and analyses done of the participant characteristics that are commonly reported in research. And what we can see is that across time, there's been very little consistency in the characteristics reported. And that's not gotten much better over the past 40 years. So still at 2021, only having time since stroke, age and sex reported with more than 90% consistency. And this is a problem because we really need high quality reporting to support our research. And poor reporting, it impedes our ability to replicate research, to implement research into practice, and to conduct secondary data analyses. So if our participants aren't well described, it can be difficult to know if a treatment that works for a research participant is likely to work for a person with aphasia in a clinic. And if participants are described in different ways, it can be difficult to combine or compare data from different studies. So this is work that I undertook with colleagues Megan Isaacs, Maizun Ali, and Marion Brady. And we really sought to gain international and multidisciplinary consensus on reporting standards for participant characteristics in aphasia research. So we conducted a 3-round eDelphi exercise, so an online consensus process, and then we held an international consensus meeting. So we had clinicians and researchers and journal editors respond to a question about what they thought was important in terms of describing participants in treatment research. And we looked at that using qualitative content analysis, combined it with some of those literature sources which we saw in the first slide, where we have items that were drawn from audits and individual participant databases. And then we had our participants rate the importance of those characteristics on a 9-point scale. We then had an international consensus meeting that was supported by CATS. And within this meeting, we thought about those characteristics in relation to a number of factors. So we thought about what's currently collected, what's important to collect. We thought about what we know in terms of characteristics that influence recovery. And we thought about how easy or difficult it would be to always report each of these characteristics. And at the end of this process, we established agreement on 11 characteristics that should be reported for people with aphasia and 3 that should be reported for communication partners. And this table that you can see on the screen is part of a checklist that is available to be downloaded from the CATS website, and I'll share the link with that to you in a minute. But basically what we've done there is we've gone through the characteristics that reach consensus, we've defined them in terms of existing data dictionaries and commonly used definitions, and we've established values for those characteristics so that we're not only just reporting the same characteristics, but reporting them in the same way. And that's important when we go to try and compare this information or combine it later on. So we ended up with age, years of education, biological sex, language of treatment and testing, the person's primary language, the languages used. So this the emphasis on language and recognition of the importance of factors around linguistic diversity came through really strongly from our CATS panel. History of conditions that might impact communication or cognition, history of previous stroke, the lesion hemisphere, time since onset of aphasia, and conditions arising from the neurological event. And for communication partners, we had age, biological sex again, and the relationship of the person to the person with aphasia. So the QR code on the screen will take you to the describe page on the CATS website, as well as the web link up the top there. And on that page, you'll be able to access some of the information, a video about how we actually developed the checklist, which provides a bit more detail. But you can also download the checklist, and we're currently in the process of finishing up an aphasia-friendly version of the checklist, which can also be used with participants with aphasia and research to collect that information in an accessible way. This research has been published now in Clinical Rehabilitation, so the link there is on the screen as well, and that does go through and obviously explain the whole process. So the next piece of work that I'm going to talk about before handing over to Erin is the Roma core outcome set. So this particular study goes way back to 2012, so a little bit over 10 years now, and really came about from the idea that in research we use a lot of different outcome measurement instruments. And at the time that we started this research, we really weren't sure whether we were actually measuring outcomes in research that mattered. So mattered to clinicians who are end users of the research, and mattered to people living with aphasia who need to use research information to make decisions about their healthcare. And we also weren't really sure whether the measurement instruments we were using were the best ones to actually capture the effects of our interventions. So across systematic reviews, we saw a really common pattern of lots of studies, but also lots of different outcome measures being used. So when we went to synthesize or analyze that information, aggregate it, it became really difficult. So with the Roma Core Outcome Set project, we set out to develop a core outcome set. So when we talk about a core outcome set, we're talking about a set of outcomes and corresponding outcome measures that should be used in all treatment studies for a particular population. And in this case, we were talking about people with post-stroke aphasia. So we use the methods of the COMET initiative, and they're a group who have really led the way in terms of developing methodology around core outcome sets. And we started by thinking about what we should measure. So really, what outcomes are meaningful and important to different stakeholders in aphasia rehabilitation. So we conducted a trilogy of studies where we talked to people with aphasia and their family members, to clinicians and managers who work with people with aphasia, and also researchers to get their perspectives on what really is important to measure. So once we had thought about the what, we then thought about how. So how should we measure those outcomes? And we conducted a scoping review of outcome measurement instruments. And then with the support of CATS, we have since had a series of international consensus meetings. So the first in London and the second in Portugal. And we have an upcoming meeting as well in Iceland. Following on from that, we wanted to really think about, well, we've worked out what we think we should measure and how we think we should measure it. But we know that for a lot of researchers, changing their practice is a big thing. So we really wanted to look at what were the barriers and the facilitators to actually implementing the core outcome set and to researchers taking it up. So this is just a little summary of what the outcomes really were of our consensus meetings. So during the first and second consensus meeting, we agreed on measures for language, emotional well-being, quality of life, and communication. We still have some gaps in our core outcome set, and that's something that we're going to be talking about when we meet in Iceland this year. And as with the described checklist, you can find a lot of information about the Roma core outcome set on the CATS website, so via the link on the page and the QR code. And I've just listed there the two main papers that have reported the outcomes of our consensus meetings to date. And that's all on the website as well. So for Roma, as I mentioned to date, we've established agreement about outcome constructs and outcome measures in particular domains. And really next in this program of research, we're looking at some of those missing measures. A big emphasis for CATS is also progressing multilingual adaptations of those measures. So making sure that they're available to, the wide range of languages that are represented within CATS. We've also, from our work looking at barriers and facilitators, that's really told us that we need to provide more detailed guidance about when to use the core outcome set, when not to, what to do if you need to change something, if you can't do something. So that is something that we're really looking towards at our meeting in Iceland. And we've also got some exciting work happening looking at benchmarks of meaningful change, that should be, on the Roma core outcome set measures. So trying to get some figures and values around what actually constitutes a meaningful change on those particular measures from the perspective of a person who has aphasia. So Roma 4 is happening in Reykjavik in Iceland alongside the Nordic Aphasia Conference on the 13th of June. And if you are interested in being involved in that, please do get in touch. My details will be at the end of this presentation. But on that note, I'm going to hand over to my colleague, Erin.
Thanks, Sarah. Okay, so my role here today is to showcase the Trials for Aphasia Panel group, which is a working group within CATS. And I have to say I'm really proud of the work that this group has put together, and I get the benefit of showcasing this work and sharing it in this forum. To really, one of the major goals of TAP is to assist clinicians and researchers to improve the conduct of randomized controlled trials in aphasia rehab. So what I've done here is literally put some slides together off the website so that I can walk you through how to find the TAP subgroup on the website, but also show you through some of the resources that will assist researchers who are looking to do randomized controlled trials to the highest quality standard they can be. And I have to say, if I had these resources 25 years ago, I think the research that I've done to date might well be a little different than it is now. It's always the benefit of having 20/20 hindsight, but when you have a look at what these resources are and the depth of the resources that I'll show you through, they really are making life so much easier to be able to design and put together a clinical trial than they were certainly in the last 15 years or 10 years since CAT started. You also note down the bottom, and I left it in there, that they were last updated in January. These resources are the most up-to-date resources that are available around clinical trials and implementation of research in aphasia that we've got in a single location. So I highly recommend them. Sarah, would you mind going to next slide, please? I've also, thank you, left the list of people who are on the trials panel. So you'll see there's a group here from all over the world who have done clinical trials in aphasia. It's a fairly large group, but one of the reasons that I've left this specific list up is so that one of the services that TAP provides is ask us a question and we can help you design your research project. So in the website, as I'll show you, there's a little box and you can get in touch with the panel, sub-panel, with questions around designing studies, so intervention studies that help us. So thank you, Sarah. Go into the front page of the website to aphasia resources, and next one there. Down into the TAP, and it's quite a way down. So if you go in the first swipe of the pages on TAP, you won't see it. So you actually need to scroll down because there are so many resources available. So make sure you scroll down and find the TAP panel. Next one, Sarah. And you'll land on this diagram. So this diagram is an interactive diagram. When you go through it, each of these icons has pages behind the icon that will show you different evidence that supports the research priorities. So it really is a beautiful one-stop shop to be able to find the best clinical practice guidelines, accessible information around being able to help your study get through ethics. There's consent materials, there's patient information sheets, there are ethical guidelines around consenting people who might be perceived as vulnerable by ethics committees, sample size calculations, and I'll show you a couple of pages as we go through. The next, so it's staying there. This is in particular one of the pages that is a huge resource around before you even get started, or what you think is important about landing on your clinical question. This page has so many helpful handy hints to be able to say, go and have a look at these, read them, at least be aware of these reporting guidelines, of how you get started to do a clinical trial, who needs to be involved in the clinical trial, how you build your team, who's in the expert group that can help you, who's your statistician, where do you get them from, research designs for studies. It really is a fantastic resource. Next one down, Sarah. And then one of the most important parts of the research that I thought I'd showcase was what Sarah was just talking about in relation to measuring the outcomes. So you see the work that Sarah was showcasing is in a different part of the CATS website, but because we feel like it's a central core element to running clinical trials and intervention studies, we've incorporated the information that Sarah was talking about in outcome measures into the TAP so that you don't have to go to a different site to find these resources, and you look straight in and be able to come out with the patient reporting guidelines for SPIRIT, for example, what assessment outcomes to take or to collect, and then how to set about recording and reporting your clinical trial. Next one down, Sarah. Thank you. One of the biggest things that we talk about with randomized control trials is how do you randomize? And just as an example of the amount of work that's gone in to be able to support people to do clinical trials, when you look at randomization and how you would do randomization, this page gives you, and this is not the whole page, a number of resources that will help you determine how you might in your study, implement randomization. Some of these resources are free of charge, others are involve a cost, but that you'll also know there are software services that can help you be able to randomize, so that it takes away the age-old envelope style of randomizing patients to clinical trials that we should be far and away not using in our studies to date. We've got all these beautiful resources, and people need to be able to increase the rigor of the studies that they're conducting and be able to use these types of resources in their studies as they go forward. Next one down. Okay, one of the other reporting guidelines or planning, I tend to show these in terms of it's much better to have the understanding of these, so you know what the expectations are when you're reporting the results of the research that you're undertaking. And whilst this is for randomized clinical trials, I strongly encourage people who are doing any kind of intervention research to make sure that you are aware of these reporting guidelines, because what we need to be able to demonstrate in our aphasia research moving forward is that you're reporting intervention that's going to take the shape in a clinical trial to be able to get to the evidence-based practice level. It has to go through the rigors of these staged phases of research implementation and evaluation. And these intervention reporting guidelines, the TIDIA checklist and the TIDIA for aphasia checklist, are really important. So the TIDIA for aphasia checklist is being developed by one of the working groups in CATS, led by Lucy. Now I've just had a name blank.
Dipper.
Dipper, it is. I see, you know, I've got it on my page, Lucy Dipper. Sorry, Lucy. She's doing a great job on being able to map the reporting checklist for the TIDIA checklist to aphasia studies. So this gives us another level of reporting standard that will help our efficacy of aphasia outcomes and intervention studies to give us a better background of evidence that we've got available to be able to implement. Next one down, Sarah. I think that's just about it. And that's just another showcase of the TIDIA guidelines that Lucy's doing as a part of the current CATS projects that are listed on the website. So again, these are all projects that in green have been completed. Some of the ones that Sarah talked about with the Describe and the showcase of the aphasia studies, the TIDIA guidelines that we're working on to be able to report intervention studies as a whole. Next one down, we're just about done. And can I just, before we close out, acknowledge the work that Katarina Breitenstein and Katarina Hillary have done in the CATS TAP work. Without their dedication, that website and web page wouldn't have those resources there. It's just an amazing resource, a valuable resource, and I really encourage people to go and have a look. Dave, over to you.
Thank you very much, Erin. And thanks to both Sarah and Erin for a wonderful overview of what really have been a lot of advances in the last 10 years in terms of what we measure as outcomes, also how to plan and design trials in aphasia. So I think it's actually a wonderful time to be, if not starting out, getting more into aphasia trials with these type of resources and building on all of this exciting work. So thank you both. So we are going to leave it there. As I mentioned, if either of you have any of you have questions for either Sarah or Erin, their contact details are there. They'd be more than happy to follow them up. And keep your eyes peeled for, there will be another seminar next month to celebrate the 10-year anniversary of CATS. But thank you very much, everyone, for attending.
Thanks, Dave.
Thank you.